The incidence is going up and up and up with no end in sight. Breast cancer finally surpassed lung to become the #1 cancer on planet Earth.
I remember the surgeon telling me, he's like, it's not if you're going to get cancer, it's when. He goes, we are seeing so much of it right now. And I just looked at him, knowing the work that I do and even the work that you do. And I'm like, I'm not buying that.
No way.
I'm not buying that at all.
Let's think about the main contributors.
Every teenager needs to know this. I want to share a story with you guys about myself. Back in 2022, I was scooting along thinking I was healthy, doing all the right things, trying to follow the right diet, exercise plan, you name it. After all, I live and work in this space, right? Well, to my surprise, I found one day in the shower a breast lump. And what transpired after was horrifying. And I know a lot and I have a lot of resources. I went to multiple appointments. First had, of course, the mammograms, the ultrasounds, then the request for a biopsy, then the request for an MRI, then the request for another biopsy. It was exhausting. But good news, it was all normal, no cancer in sight, and I now have a little tag in this right breast that I get to walk around and carry with me for all the years to come. I did not have breast cancer. My mother did. She had stage 0 DCIS. She's actually doing okay as well. But this topic, breast cancer, the mortality, the incidence, the increasing risk in younger and younger women continues to be something that patients ask me about every single day. That's why I felt like it was so important to learn as much and understand what we can understand about this diagnosis that continues to plague women today. Please help me welcome my next guest. Dr. Kristi Funk, MD, is a double board certified breast cancer surgeon and lifestyle medicine doctor. She's a best-selling author, an international speaker, and she graduated from Stanford in 1991. Her medical degree is from UC Davis, and she completed her residency in Seattle and a breast cancer fellowship at Cedars-Sinai in LA. She has excelled in so many different roles, including as a director of the Cedars-Sinai Breast Center until 2009, where she also co-founded the Pink Lotus Breast Center in LA, where she currently practices. She has helped thousands of women navigate breast issues, including celebrities like Angelina Jolie and Sheryl Crow. She is the go-to expert for Good Morning America and Dr. Phil's Merit Street Media, and she's been on a host of television shows, including Dr. Oz, The Doctors, Rachel Ray, CNN, The View, and more. I couldn't be more honored, more pleased, and honestly more excited to introduce you all to Dr. Kristi Funk. All right, Dr. Funk, thank you for joining me today.
Thanks so much
I
for
can't
having
wait
me.
to get into this conversation. So you live and breathe breast cancer. You've been doing this for a really long period of time. What do you think is going on with breast cancer in women? You know, we have our October every month. We're screaming pink. We are doing the marches and the walks and the mammograms and all the things. Mm-hmm. But when we really kind of dial into the data, we're not really seeing the incidence of breast cancer go down. Now, we can talk a little bit about treatment and all that other stuff. But I'm just so curious. You've done this for, we were just talking 23 years,
Yes,
right?
Yeah.
What do you think is happening when it comes to the world of breast cancer?
I know what's happening.
You know, that's why we have you on the show. I love it. All right, talk to us. What is going on?
So let's look at the stats.
Okay.
October 1st, 2024, the American Cancer Society just came out with breaking news, new numbers analysis. Since 1989, what we've been seeing is that the incidence of breast cancer, to your point, is going up and up and up with no end in sight. It's been going up 1% per year. But get this. In the last 10 years, it's been going up 1.4% per year in women under 50.
Ooh, I don't like that.
And 0.7% in those over 50. While the mortality, thankfully, has been going down about 1.3% per year owing to earlier detection and better treatments, the incidence is going up and up and up with no end in sight. If you don't know, in 2020, breast finally surpassed lung to become the #1 cancer on planet Earth.
Oh, my goodness.
It is a real serious problem. We've got to figure out where this bullet train is headed and stop
Do something about it.
Yeah. It's not only getting higher in numbers, but lower in ages. So, I mean, if we had made a bet back in medical school in the in 1992 for me.
Right there with you. I think I graduated in 93. So anyhow.
I would have put big money on not necessarily the cure for cancer, because I recognize cancer is a very elusive, sinister little thing. Mm-hmm. However, I would have thought for sure the numbers would be lower, both with incidence
and with all
mortality.
The work that everyone is doing or trying to do. I think it's interesting. You know, I had a little breast issue. It was about a year or two ago. I found a lump on my own in the shower, and you know, with our schedules, and you're going to get mad at me, please don't get mad at me. But anyhow, with our schedules, I made the first appointment, the second appointment, then they wanted a biopsy, then they wanted an MRI. And it was like 4 or 5 appointments to figure this thing out.
Right.
And with my schedule, it took me 6 months. It wasn't like I was doing you know, back to back to back.
Right.
And at the end of it, everything was fine. You know, everything was normal. Everything was okay. Thankfully. I have a little tag, thankfully. But I remember the surgeon telling me, he's like, it's not if you're going to get cancer, it's when. He goes, we are seeing so much of it right now. And I just looked at him, knowing the work that I do and even the work that you do. And I'm like, I'm not buying that.
No way.
I'm not buying that at all. But what do you think is happening with women and the increased incidence of breast cancer? Where can we look? Because right now the dialogue is all get your mammogram and you think you're done. That's it. If you're doing that mammogram, you're done. Your breast cancer story is over. You check the box, you can move on. But I know I think differently, and I know you think differently. So I want you to really reflect on what you think is happening out there with women and why they need to really change that mindset.
You said the word reflect. We just need to look in the mirror and reflect at our own lives and recognize that you have so much more control over this disease than you probably ever thought or could possibly imagine. But the science and the research clearly shows that only 5 to 10% of all breast cancer is coming from inherited genetics, right? Like BRCA or CHEK2, PALB2, these mutations.
Wait, let's talk about BRCA for a second. I get this all the time in the exam room, all the time. Well, I don't have BRCA. You know, I know I'm not BRCA positive. I'm okay. What's going on there with that conversation?
The answer is 95% of women with breast cancer do not have BRCA.
Wow.
Or any other gene mutation for that matter that they inherited from mom or dad.
Wow.
So 87% of all women with breast cancer do not have a single first-degree relative with breast cancer. So even the inherited genetics aside, just sort of that it runs in my family kind of thought is largely false. It's real when it's there, and we need to pay attention to this elevated risk status because of something in the water, so to speak, with the family.
Right.
But the vast, vast majority of cancer patients do not have it run in their family, and it is absolutely not from an inherited gene. And this is fantastic news.
Because we can do something about it.
Because we can do so much about it.
Well, where is it coming from?
Okay, so it's coming from a number of different avenues, and they're going to bump and collide inside of you in different ways to manipulate the cell microenvironment, the little tiny bathtub that is composed of the fluids and cells that your cells bathe in. And that bathtub is either screaming out pro-cancer or anti-cancer. And you are choosing, unwittingly or not, every time you lift fork to mouth, every time you think or don't think something, drink or don't drink something, do or don't do something, even forgive and don't forgive someone.
Ooh, I love that you brought that in. I love that Chinese medicine talks about this. They talk about anger and grief living in the liver, and then the liver becoming sloppy and sluggish. The liver meridian, guess where it runs through? It runs right through the breast. So anger and forgiveness go hand in hand in this conversation. I love that you brought that up. It makes me so excited.
Right. Well, I have so much to say about that. And the science does too.
Yeah.
Now, some of these things are stronger contributors than others. And some of them, the science has kind of uncovered the why behind it with more clarity than others. But absolutely, the strategies that you can employ starting today that will radically transform not only that cell microenvironment, that bathtub, that then is pro-cancer or anti-cancer, but all of the different mechanisms that lead to all of our major killers. We're talking heart disease, stroke, diabetes, Alzheimer's, obesity, and things that don't necessarily kill you, but they kill your joy and your zest for life, like anxiety, depression, irritable bowel, arthritis, autoimmune disorders, just inexplicable fatigue and right?
Totally.
It's so exciting. So the main contributors to this whole world inside of us that's driving our health destiny on so many different levels have to do with your nutritional choices, exercise, obesity, alcohol use, and other toxicities like smoking.
Mm-hmm.
To a certain extent, for women, hormone replacement therapy, and that's a big,
we got to go there in a minute.
Yes,
Right,
it's a big thing, and I have definite thoughts on that, backed by science. Environmental toxicities. We live in a barrage of chemical toxicities that are in the air and in this chair,
right.
But also just you can be wiser about your own choices for things that you're putting on your skin. So everything from soaps, toothpaste, laundry detergent, perfumes, cosmetics, dish soap, on and on. Be cognizant of what's in your direct contact all day long.
So this is a cumulative load. I think people hear this and then they are kind of like, well, where do I start? Like, what do I do? Right? Because the science is there. I know you've seen it. I've seen it too, which really talks about cancer being sort of a cumulative load of all of this stuff. And I think the two words, tell me if you agree with me or not, in all the work I've been doing on hormones and talking about hormones and, going into menopause with hormone shifts and all this other business, the words that keep coming up are oxidative stress, which is that cell not getting the energy it needs, right? And then chronic inflammation, which then become the drivers of cancer. So when you are talking nutrition and toxins in the environment and what we're putting on our body and how we feel and our emotional health and all that stuff, I feel like those are the two big words where all of that is being sort of determined, right? Like your oxidative stress is being determined by that entire list that you just gave us. Your levels of inflammation are being determined by that. And that applies to breast cancer as well?
100%. So when you, for example, chew and swallow down food, you're elevating estrogen levels in your body, a growth hormone called IGF-1, which is the hugest growth promoter, angiogenesis, angio blood vessel genesis birth. So it's the birth of new blood flow that every cancer cell in your body must acquire this new blood flow if it aspires to be bigger than the tip of a ballpoint pen, which what cancer doesn't have those big dreams. Insulin sensitivity and resistance. And those things all contribute dramatically, fundamentally to oxidative stress. So now you've got this inflammation and this chronicity sets up immune system dysfunction and dysregulation. So when DNA damage happens, you are ill-equipped to swoop in and repair it. So now these damaged DNA cells, i.e. cancer, that is what cancer is, have free license to grow and proliferate out of control and unchecked and unfiltered by an immune system that should have been highly intact and functional. But because of choices that you don't realize you're making directly impact this inflammatory state and this oxidative stress imbalance, your immune system is handcuffed. It has too much to do. It's overwhelmed. It's overtaxed. And decade after decade after decade of consistently living with less than optimal choices will land you something. Fill in the blank. It may not be breast cancer, but it will be heart disease or stroke or diabetes or joint issues and irritable, like all the things that we listed. They're the outflow of chronic inflammation.
So when we were back, if we think back, we're not 50 years out, we're 20, 30 years out. But if we go back 50 years, was this an issue then?
It was an issue to the minority of people. Now we're looking at 72% of Americans being overweight or obese. 1 in 3 is pre-diabetic or diabetic, and on, right? Like in 1990, 12% of America was obese. Now it's 35%. So it was there. It was just on a lower level. And so were a number of other things, such as ultra-processed food.
Right.
Literally 50% of all calories consumed by the average American today come from ultra-processed food every single day. 50% of the calories. Again, I mean, I am very passionate about all the things that contribute to I'm hyper focused on breast cancer, but you can fill in the blank of your disease every time, right?
True. Very true.
But to think that you think that a Lay's potato chip is really good nutritional armor for your cells to fight off this inflammation we've been alluding to is delusional. You said something in passing that I want to kind of bring back
go there.
Because I think I have a nice way of putting into the framework of your thinking as a listener, like, whoa, this is now just overwhelming. It seems like I shouldn't even get out of bed because I'm just going to do it wrong.
Right. Totally.
So let's think about the main contributors. They have a much higher percentage in the science and in reality in your body contributing to this oxidative stress.
Right.
So think of all of your choices in a balance, right? And so you can tip scales. There are boulders. One good boulder and bam, that scale is so tipped that anything else you're putting on the bad side, it's like a pebble. It's a grain of sand. Like it's already down here. So the boulders that drive us toward an oxidative stress situation, very conducive to breast cancer formation, are going to be eating animal protein and fat. So you lift that boulder off by being more plant forward, or in my perfect world, entirely whole food plant-based. Mm-hmm. And I emphasize that phraseology over vegan.
Right.
Because whole foods are where it's at. We can talk a lot about that if you want to. Another boulder, obesity and just too much fatness. Not sure? Google body mass index or BMI. Put in your numbers. As a poor man's index, there are better ways of measuring it. But basically, if you're over 24.9, we have some weight to lose and a boulder to lift. Next one, being sedentary.
All of us.
I love the data pouring in on how exercise, but just movement, just moving more, just parking a little further away from the grocery store. Why are you zipping in circles and circles trying to get the closest spot? Park far away, make yourself walk.
Now, is this being sedentary separate from being obese, or do the two go together?
They are synergistically bad for you, but they are completely independent.
Wow. Do you know how many people sit at their desk all day long?
I do. And guess what? You have to pee and maybe even do number 2. So when you do, why do you walk 10 feet away and go to the bathroom? If you're in a building, take the stairs, purposefully use the toilet on the first floor, whatever floor is farther away from you, and then take the stairs back to your desk. Little things like that are cumulative. So we can jump into how much exercise and movement because it's also science-based.
Right.
But to finish the thought of boulders, our last boulder is alcohol.
Yes.
Alcohol has so many detriments. We can deep dive into that. I really love talking about it because it's ubiquitous and it's associated with cultural and social norms that we need to bust. And I actually have seen a really strong trend, as I'm sure you have.
Yeah, of women.
Towards sobriety.
When I started practice, I'm 15 years in my integrative practice, but when I started, it was like so many women coming in saying, oh yeah, I drink a glass of wine every night or 2, and that was their relaxation technique. And now more and more, I think the awareness is out there that, oh no, it's just the weekend. It's not like every single night. So that is shifting.
It's shifting, but I think there's a lot of work to do and enlightenment to create because we see what we want to see. So there are, for example, if you yourself have cut back or completely are done with alcohol, you're going to start noticing the people who do what you do.
Right.
If you're remodeling your home, you are acutely aware of, oh, the molding over here, the floor. Oh, look at that ceiling. Oh, the color choice. Is this beige or is this, you hyper focus on things that you're interested in. So if you are unaware of the detrimental effect of alcohol use inside of your body, you will largely go through your day still unaware and not seeing the signs and hearing the facts.
Very much so. Now, does alcohol and sugar kind of go together? Or again, are those independent?
Alcohol and what?
Sugar.
Oh, sugar. How interesting. They go together in that alcohol is another source of refined sugar.
Right.
But cookies, cakes, pastries, ice cream, bagels, pixie sticks, pure sugar.
I remember pixie sticks. Remember that? It's Halloween almost too.
Soda. All of these choices are really bad, pure refined sugar.
Right.
The problem, interestingly, is not so much the sugar as the insulin that goes flying out after it.
Right.
So we have this scale and we have these 4 big, heavy boulders in the forms of animal products, being sedentary, and being overweight, drinking alcohol. But some people are like, none of those is a vice to me. I'm good.
I'm on
My
top
scale's
of it.
balanced. Well, now is when the pebbles can start to shift things toward illness instead of health. And those smaller pebbles that contribute are going to be environmental toxicities, emotional stress, hormone replacement therapy, a lack of restorative sleep, and a lack of fasting.
Interesting. All right, we got a lot to unpack here. So let's go back to the boulders. I think that's a good place to begin. So you mentioned diet and you mentioned animal protein in particular. Right now we're in a culture and a context of protein, get those protein grams up. It's difficult to get those protein grams up when people are becoming vegetarian. I have so many, people complaining to me, women complaining to me about that. Is it no animal protein? Is it a moderate amount of animal protein? Tell me what the science says about animal protein and breast cancer. And is it an issue of excess consumption, quality? Tell us a little bit more about it. And, dial through that just a little bit more.
Okay. So every time we're asking a question about animal protein and cancer risk, the question I always ask back is compared to what? So, for example, processed meat, what's that? Sausages, bacon, hot dogs, but everything that comes out of the deli case at the supermarket, including organic chicken breast, turkey breast, right? All
the sliced stuff that everyone's using in their sandwiches and all those other places.
And the charcuterie board at the fancy party.
They're so pretty though. But anyhow,
they're so pretty and they're absolutely carcinogenic to all humans. So the IARC, the International Agency for Research on Cancer, is a subdivision of the World Health Organization. And in 2015, there were 22 researchers in Lyon, France, they weren't locked in a room, but they're in a room. They're from 10 different countries, right? So we have a real smattering. And it's important to me to emphasize, if you don't know, that the IARC is not bought by anyone. And while I don't want to deep dive into that right now at all, funding is a big issue when it comes to research outcome. You can manipulate data in so many ways, and that happens, but not at this level. The IARC is all about telling us humans on planet Earth what definitely does or what probably does cause cancer. End of mission.
Wow.
So in 2015, they were charged with the responsibility of looking at these 800 epidemiologic studies and answering two questions. Does red meat cause cancer? Does processed meat cause cancer?
Okay.
And what they concluded was that all processed meat is a class 1 carcinogen, which means it absolutely is carcinogenic to humans with the same certainty as plutonium, asbestos, tobacco, and alcohol. All processed meat.
Plutonium and asbestos equals turkey deli meat and charcuterie boards.
Yes, it does. Now,
okay,
with scientific certainty, not with the same power to cause the cancer.
Right.
Okay. So that's mind-blowing because these deli meats are at everywhere. They're everywhere. They're in every school lunch box in America almost.
And I love that you said too, I hope everybody caught that. I love that you said, even if it's organic. I think there's a lot of it's organic, so it's okay. No.
When it comes to meat, certainly eating a pure form of meat will eliminate the excessive use of antibiotics and hormones and the GMO feed that's dumped with glyphosate that animal then eats that actually gets into your body.
Right.
Glyphosate has been in the quantities you would get from a typical GMO soybean consumption, right? Which all the animals are eating these GMO soybeans as part of their food. You drip that amount of glyphosate onto a petri dish of human breast cancer cells and they immediately grow.
Wow.
It is a pure estrogen basically fueling the growth of these cells. So when we think about the purity of the meat, organic or not, yes, you're escaping some of these toxicities that are added to the animals that get into the food that's on your plate. However, there are other considerations, including what is naturally in the meat that the animal itself just had in the meat. So we're talking trans fat, saturated fat, cholesterol, heme iron, nitrates. This is in organic meat because
Right.
it is meat.
Part of meat, right.
Number 3 then, so what's added to the meat is something you can avoid by choosing more sustainably raised, etc. You can never escape what's in the meat. You can never get what's not in meat, namely fiber
Right.
and water and certain vitamins.
It slows the gut down, all of these things. Yep.
Exactly.
Yep.
I mean, we could wax on about fiber. It's
Right.
my favorite
Right.
thing to talk about.
Whole different episode. So anyhow.
Fiber. And then sometimes then if you're, when you're thinking about eating meat, you are thinking if it's organic, you're not harming your insides, but you have an automatic reaction to the presence of animal protein that does not care at all about how pasture raised it was, how happy it was, how many acres it could roam before it was put on your plate. And that response is to elevate things that we've talked about, the estrogen levels, the growth hormones, the angiogenesis, the insulin resistance, and all of this stuff that leads to the playground for cancer.
Now, couple this whole issue with meat around what you already alluded to, which was obesity and blood sugar and insulin resistance, right? So somebody on a plant-based diet who is concerned about their cancer risk, what is the best way for them to manage blood sugar stability and insulin resistance, aside from exercise and movement and consistent sleep? What would you tell them?
A lot of insulin regulation is coming from, I think, 2 main pathways you want to think about. One is your saturated fat consumption. So you can still, of course, get saturated fat in your plant-based eating. It's going to be a lot harder than one fillet of beef, right? Or steak. I don't even think about meat anymore.
That works. We need to move on from meat.
Yeah, exactly. So one thing that's happening with saturated fat, you've got these insulin receptors that sit on cells, right?
Right.
And when so glucose is happening and blood sugar's in the bloodstream, and the pancreas is like, oh, let me throw out some insulin to manage this glucose. We need to use it and store it. So I'm going to send out insulin to hit this gate, hit this receptor, which is when inhabited by insulin, is going to say, hey, glucose gate, open up, let the sugar in. All right. Now, what happens, people think that diabetes is a sugar problem.
Right.
It is a saturated fat problem.
Wow.
What is happening is saturated fat is literally, when it's too plentiful, hiding, and it stuffs itself in part into insulin receptors. So now, eat your meal. Doesn't have to be candy, just a normal meal. It's going to elevate your blood sugar. Out comes the insulin. Oh, let's deal with the blood sugar. It's flying around going, whoa, I can't get in here. I can't get in here. And the receptor's like, oh, I'm stuffed with fat. I can't hear you. I can't hear you, right? So the insulin isn't giving any signal for the glucose gate to open. So it's still shut. And your pancreas is like, what's wrong with you people? I'm going to throw out more insulin. And the glucose is still running around. And everybody's screaming that, oh my gosh, her blood glucose is so high. And now comes the hyperinsulinemia because the insulin's trying to get this message across. And the whole problem is the fat. So you eat a low-fat plant-based diet if this is one of your medical issues right now that you're dealing with, insulin resistance. And all of a sudden, the fat will melt away from the receptor. The insulin that comes out on the first pass will be enough to hit that receptor, open the gate, down goes the sugar, and look how beautiful your blood panel is.
So then what do you say to and I don't want to, get too deep in the weeds on this, but what do you say to the keto community? Or, some of those folks that are coming in trying to manage their insulin resistance by really increasing all kinds of fat in their diet. What does the science say too about that when it comes to breast cancer, insulin resistance, and trying to close this gap?
You will not be able to show me a long-term study looking at keto and its long-term effectiveness. In the short term, yes, blood sugar gets better regulated. Even hemoglobin A1C comes down. We have to watch out, though, what's happening behind the scenes with cardiac disease. And what you really need to make sure you're okay is an oral glucose tolerance test. Unless you're doing that, the hemoglobin A1C isn't really the truth. What we need to know is that when you swallow down liquid sugar, your receptors receive that insulin readily and deal with it quickly on the sugar level. And that test is often failed by people on keto.
Oh, I think that's such a good point because so many people look at their A1Cs and think they're fine, and so I think that's a really important point as well. So plant-based, whole foods, any tips? How do you make that a reality in day-to-day life for people who are like, I want to do this and I want to protect my risk given the environment that we're in today?
Right. You can get really excited about this and then you open up your refrigerator and you're like,
oh, crap.
Just give me the turkey sandwich. I don't know what's happening right here.
This is too hard.
So there are so many resources with just a good Google of, plant-based recipes and so many sites. I have created Pink Lotus Power Up. It's a community filled with a ton of members. It has over 50,000 members. And in there is a kitchen where I have recipes. I have a cooking show once a month that shows you up close and in person how we can make plant-based eating simple and quick. I have 3 teenage sons. I am working full time. I don't have time I feel like all my free time, if I'm not exercising, I'm chopping vegetables. Yeah, right. But the way you make this a reality is to recognize that if you're honest and you are like the slice of American pie that we know to be true, you only have 8 meals that are your go-to meals.
Very true.
All right. So revamp them to be plant forward if we're transitioning or entirely plant-based. Breakfast is super easy. No. Let me give you, breakfast could be a smoothie. It can be oatmeal, but not just oatmeal. Add some flax seeds, some cinnamon, some berries, top it with some seeds and nuts, and boom, you have a really great meal there. You could do avocado toast. You could do a tofu scramble instead of egg scramble, right? There's a lot of easy things for breakfast. Just look at your current meal. So I ate, when I became totally plant-based, and so did my entire family, on a dime in 1 minute 8 years ago. Before that, I would say for lunch, I'd have a massive salad with a salmon fillet on top and a bunch of feta because I love cheese.
Me too.
Okay. So now if that's you look at that salad and say, you know what? I'm going to replace the salmon with maybe a grilled bar of tofu, right? And the feta cheese, I personally don't need, but you can do some sort of vegan substitute cheese kind of thing happening, or just recognize that you don't need that and have a more delicious dressing with nutritional yeast in it, which makes it like a cheesy flavor if that's what you're after. My point is, look at the meal and see what can sub for what used to be the protein star of the plate. Dinner, chicken, vegetables, mashed potatoes. Okay. Mine, of course, was always skinless, boneless, organic chicken breast. Again, better than the thigh with skin from a GMO chicken. But the point is, we want the chicken off the plate. So what can I put on instead? I have a favorite chicken substitute in the form of seitan, which is...
Oh, yeah.
Okay, not the devil. Right. This is unfortunately not for my gluten-sensitive people out there or celiacs.
Right.
But that is surprisingly fewer than the people who think they are. 1% of America is celiac and maybe 5% have gluten sensitivities. And yet there's a whole industry now, advertising to the gluten sensitive. So I think people think they mistake things. I digress. So the point is, this is a really delicious, chewy, it's like a vegan meat for us that eat plant-based because it has the consistency of meat and takes on the flavoring of the spices you choose to use. So I buy it in bulk. And so it just is like flour. It's wheat gluten. And then it takes literally 4 minutes in a food processor for me to get all that ingredients in. And then it forms this doughy bread-ish thing that you can roll into whatever. So I make little chicken cutlets
out of it.
And then you steam it for 30 minutes. And it is there's the star of my plate. 24 grams of protein for 1/3 of a cup.
Wow.
And my kids will eat a cup. That's 60.
So, when patients are coming into you and they're either concerned about breast cancer or they've had a diagnosis of breast cancer, when they transition to sort of more of this plant-based diet, what are you seeing? What are you seeing kind of in the exam room? What are you seeing maybe on imaging? What is some of the benefit of going through this?
Well, if they already had their cancer surgery, they're in maintenance mode. What they tell me isn't necessarily, there's no real cancer marker, right? Unless they have a recurrence on the horizon, everything looks fine. The imaging is clear and their blood tumor markers are negative or normal range. So what I hear them say is, oh my gosh, and then enter in all the side benefits that I mentioned. I didn't realize my arthritis had to do with that. I had trouble opening peanut butter jars and now My knuckles never hurt. I'm getting out of bed without my feet having that like need to wake up kind of ankle motion feeling. My skin is better. My thought is clearer. My sleep is deeper. My sex life is better. My LDL cholesterol, I got off the Lipitor.
Right. Yeah. We see that frequently. What about from an imaging standpoint? Do you see changes in dense breast or in fibrocystic breast or many of these things that women today are dealing with?
You definitely do. So plant-based eating can decrease density, but there's such a genetic footprint on density at a baseline that it's hard to manipulate that exclusively with diet. But if someone's teetering on dense, not dense, so we grade it A through D. So if you're a B, C on the fence of dense and not dense, it will usually just slide right into not dense.
Gotcha. So you mentioned some of the other boulders, and then you mentioned the pebbles, right? Which are the smaller things that you can do. You know, part of the show, we call it Science and Spirit for a reason. There's a lot of great science and data and research, and then there's a lot of just the human experience and what you're going through on any given day and how all the elements of your life kind of add up to maybe trigger inflammation or oxidative stress or joy or love or all the happy, positive things as well. You know, I have often shared this story, and it's unfortunately true, but I have sat with a lot of women over the last 15 years or so. And anytime I've sat with one that is going through deep grief, a trauma, a divorce, my heart sinks a little bit, to be 100% honest, because I can almost time that 18 months later, we're dealing with something. And 80% of the time, that something is breast cancer. And it goes back to what we were just talking about with the liver meridian and Chinese medicine. I think there is something to all of that and where we hold and store emotions. You mentioned it as one of the pebbles, you know,
for sure.
You know, what are you telling women when that shows up? What should they be doing? What should they be thinking about, you know, in terms of that as part of their breast cancer risk?
Oftentimes I will ask a woman, so the 18-month timeline is probably because something is so developed already, but the instigating time of cancer was definitely more like 7 years ago. Somewhere between 5 and 15 years, depending on the division rate of the tumor, was the first cell that went awry. Now, keep in mind, one cell becoming 2, becoming 4, these division rates take between, depending on your age, 3 to 6 months for one cell to become 2. A sugar cube of cancer has 1 billion cells.
Wow.
So when you do the division rate and the math backwards on a 1 centimeter cancer, mind you, the average detection size is 2.2 centimeters, you will find that the math will put you about 8 to 10 years ago. So I will say, what happened back then? And that was the heartache, the death, the divorce, the job loss, the major life stressor that tipped those stress scales, that created excessive cortisol output, excessive TNF alpha, interleukin 6. You recognize these things as numbers and letters that are associated with an inflammatory cascade of badness. You can deal with cortisol, again, when the proverbial bear is chasing you, right? It's the fight or flight stress hormone. It's our most potent glucocorticoid flying out of our adrenal glands, and it's highly useful when you're trying to have an engaging podcast, and so you're excited about it, or you're trying to hit the winning shot on the pickleball court, or you're giving a big presentation. So thank goodness for some cortisol when you need it most, but you do not need it all day long. It is because of the deep heartbreak that leads to that stress and depression and the existence of these markers day after day. Just
do you think women are just more stressed?
Oh, no doubt.
This generation than previous?
You know, starting in the 60s and 70s, thankfully, we had a lot of liberation, and, you know, we were able to increase our station in life and become more independent. And that all has a lot of beauty to it. But it also has some stress to it, because now we started entering the workforce in droves. We were delaying childbearing or not having kids at all, which, by the way, is a breast cancer protection thing to have children younger. It's not a reason for, Mom, I reduced my breast cancer risk. I got pregnant at 15. That's not what I'm saying. But the point is, we know that women have been delaying. I had triplets at 40.
Yeah.
So,
36 and 38. No, 34 and 36. So,
right.
Yeah.
So we were trying to get the education we needed and foster the career until the timing seemed better. There's never a perfect time, right?
Right.
Delaying or eliminating breastfeeding. We're in LA bumper to bumpering it home in stressful traffic, just in time to get home to probably lay takeout on the table or have Instacart deliver something. And then you pour a glass of wine and last thing you need to do now is get in that gym and do some treadmill work. You are sitting on the couch with a glass of red wine and you are watching your latest Netflix binge because you deserve it because you had a crazy long day
and you're exhausted. My daughter is 16. We were talking about that and she's like, you guys just messed it up. Like this whole women's rights, like what were y'all thinking? Like, well, I go, first of all, I wasn't a part of that. But secondly, I do believe in women being financially independent. I think it's very important. Many women have suffered with, their inability to be able to have choice and voice and all these other things.
Of course.
She's like, yeah, but like, God, now I have to do this too. I'm like, it's okay. You can be a stay-at-home daughter, Anyways, but no, all jokes aside, like I do think there's something there. I think that we went for it. We did it. Women are doing incredible, amazing things and contributing to society. But I talk a lot. One of my books, I talked about Superwoman syndrome. Mm-hmm. I think that we also have to now demand that society meets us to where we can be women, and I think that is something that probably I'm hoping the next generation will push forward for sure,
Well, I think something our generation is starting to implement is the new buzzword of self-care.
Right.
So the me time that is really actually just still part of my generosity to the rest of you in this world and my family.
Right.
Because the me time allows me to show up and be better for you time.
Right.
And whatever that looks like for you, it's important to prioritize it.
So important. All right. Well, let's go back to you're a young woman. You're under 50. And you've listened to this and now you're really concerned. You know now that it's a little bit of a level playing field when it comes to the incidence and the risk of breast cancer. You know that we have choice with all the things that you've talked about that are amazing. But what should someone, once they're instituting a lot of these different lifestyle changes and trying to put things in motion, what's a good screening plan? What are labs maybe? Like, should everyone go get a TNF alpha and an IL-6 checked every year? Those are maybe extreme. But like, in your opinion, if you could like wave a wand, not worry about insurance, not worry about any of these things, right? What would you tell young women to do? And I think we're talking to our daughter's age, even 16, 17, 18, 19, 20. Like, what should young women do as we continue to see cancer rise in younger age groups? What should they be doing on a yearly basis?
So the problem, as I see it, with screening and looking at certain tests is that we're just looking for the cow that's out of the barn, right? You really want to focus so that there are no cows.
Right.
So in so many ways. So to the teenager, I'm going to say, you know what, this seems crazy, but I want to teach you how to do a breast self-exam. I'm not thinking in a million years that we're looking for cancer. We're learning to be familiar with our growing, developing breasts, learn where the lumpy bumpiness is, learn that it's tender here and not there, so that, God forbid, somewhere around 20 plus years from now, if there's ever a change, you will be very clear in your mind that, this was not there before. So we need a familiarity with our own breasts. So I advocate for as soon as periods start, 11, 12, 13, we could talk about precocious puberty.
Right. That's
another story. So when your periods start, let's start learning how to do a proper self-breast exam so that you're familiar with your breasts. And then it's not like giving you the heebie-jeebies to do a self-exam when you're 45 and your incidence is elevated enough so that you should be aware of your breasts. Number 2, all the science shows that the earlier you implement the amazing thing, like cruciferous vegetable intake, dramatic decrease in breast cancer risk for just cruciferous veggies, which is your broccoli, cauliflower, kale, arugula, Brussels sprouts. Intake as a teenager has like a 50% reduction in premenopausal breast cancer. It's pretty incredible.
Wow.
So
wait, every teenager needs to know this. Say that again. Make sure all the moms that are listening replay this over and over and over again in your children's phones. But anyway, say it again.
Well, Christopher's vegetable intake in your teens and as a young adult has been linked to a 50% decrease in breast cancer risk.
Okay.
Premenopausal.
Eat your vegetables.
Eat your veggies. Mom was right again. Exercise. Get it into a routine so that it's normal for you. That there is this idea of, being sedentary is never an idea. We should always be active. For sure, children prior to college need an hour a day. We as adults, we need about 5 hours a week if it's exercise that you can have a conversation with your buddy about, right? So if you're speed walking, but you can talk about the office drama, then you need 5 hours a week. Okay. If it's super sweaty, vigorous exercise, as defined by a little bit hard to have a complete sentence, 2.5 hours a week.
Okay.
So that's
doable.
Your markers. It's very doable, especially if you're going to be super sweaty. We're talking about 22 minutes a day.
Right.
But as a child, well, I'm getting so old now that like a 20-year-old seems like a child. In your teens and early adulthood, exercise should be part of the routine so that you're already reaping like the dopamine hits and the benefits. Like you want to, like, why wouldn't you exercise? It seems crazy that you wouldn't, right?
Right.
So now we're body aware, specifically breast aware. We're eating more vegetables and we're moving more. Then we get into what do we do in the doctor's office? In your 20s, your gynecologist or internist, whomever you see, every 3 years, you need a doctor's breast exam. Starting at age 30, I want it to be every year.
Okay. That's a good tip. I hope everyone's taking notes. Every year, starting at age 30.
Yes.
Okay.
Now, some strong data suggests that both self-exam and clinical breast exams are useless when it comes to breast cancer mortality. And that's simply because people aren't good at it. That's all that is. And I think it's really patronizing, and I don't like hearing that because I have way too many astute clinicians who have sent a patient, I'm not sure it's something, but just go see Dr. Funk.
Right.
And lo and behold, that doctor just saved your life, possibly. Yeah. Or you saved your own life. I have so many women coming in with the lump they found themselves.
I found mine on my own.
You did say that, right?
Yeah.
So thankfully it wasn't cancer, but had it been.
But it has to be monitored now,
what if you ascribe to like, oh, they say self-exam is useless, so I guess what I'm feeling is not something, ridiculous train of thought. So the more early detection, the lower the mortality rate. This is a fact. So why are we not employing these fairly cheap and easy tools that have zero exposures, right? We're not talking radiation or injections of dye, et cetera. Now we are. So enter age 40.
Right.
For normal risk women, not those with a super strong family history, with genetic mutations, with prior history of a biopsy that showed what we call a marker lesion that you would know if you had, and it puts you at elevated risk to make a cancer one day. We changed the screening recommendations for that category of women to usually start younger, or more frequent, or more than mammogram and ultrasound. But average risk woman should start mammograms at age 40.
40. And you still like mammograms? There's a lot of like chatter about mammograms.
Mammograms cause breast cancer. And I still like them. Weird. Why? We use the tools we're given. And this is what's happening with mammograms. If you take 10,000 women and they get a mammogram every single year between the ages of 40 and 74, in that period of time, in those 10,000 women, you will cause 8.6 cancers from the radiation, the repeat radiation. However, you will have found 860 cancers.
So it's still worth it.
So it finds 100 times more.
And I think that's important, especially
than it causes.
Because women latch on to, and I get this question all the time, like, well, I heard mammograms cause cancer. Do I have to do a mammogram?
And I always empower women with their own decision making, but I give them some stats. So that's a good one to know. We're going to find 100 times more cancers than we're going to cause, but you are right. Mammograms do cause cancer, and there shouldn't be radiation involved. There is.
Can they do an ultrasound?
They can. So let's look at the data around that.
Yeah.
It is not as good at detecting cancer as the combination of a mammogram and an ultrasound, but as a standalone in excellent hands. So this is very tech dependent, right? An ultrasound is a probe in someone's hand getting rolled over. There's also automated ultrasound, which takes away the tech dependence, but then it's like a plate that has to be applied, with uniform pressure, and then the thing goes, it just like automatically goes across the breast and gives you a movie as a radiologist to read. So it's still at some level human dependent because we have to apply the device and then a human is reading the imaging. But the point is, in excellent hands, ultrasound is an excellent tool for cancer detection. And I think it's equal with mammography, but they see different things.
Interesting.
The one thing you will almost always miss when you try to omit doing mammogram is DCIS. Ductal carcinoma in situ is a stage 0 cancer. It has no ability to spread, so it is never treated with chemo, and it has no hope of ever killing you. So in other words, our earliest, most curable cancer is missed, it's skipped over when you're doing only ultrasound or hands-on exams or even MRI as you're screening, because the only modality that reliably finds it is mammogram. Now, someone out there listening to this, I had DCIS and it was found there are about 5% of DCIS can be a palpable lump. And if it's palpable, that means it could be visible then on ultrasound or MRI. But
all right, let's talk about DCIS for a second because you just brought that up. I remember interviewing an expert not too long ago who talked about DCIS and said, A, we're overdiagnosing it here in the United States compared to Europe and other countries around the world. And B, that DCIS is not really cancer. It's because it's localized and we are overtreating it. So we're both overdiagnosing and overtreating. What do you say to that out of curiosity? And what does the science say as well? So
I agree almost.
Okay.
So the only part I disagree with is that DCIS is cancer. So to call it not cancer is just trying to calm the woman down, because what you actually mean to say is this isn't going to kill you, right? You feel like you hear cancer, you think, my life is in the balance, right? I could die from this. I could die. Right. Hopefully you're not thinking I am going to die. But the point is DCIS can never kill you, so stop calling it cancer. But that's just because we link the word cancer with possibly dying. That's all that is. What is DCIS? Yes, we overdiagnose it. Yes, we overdiagnose it, and yes, we overtreat it. So let's talk about it so you'll totally get it once I explain.
Okay, go for it. Just go for it.
So we've got these milk ducts, right? They're like little tubes, like spaghetti tubes, and the inside is supposed to have a single cell lining. When the cells get crowded and they fill the duct tube and widen it by 2 millimeters or more, boom, that's the diagnosis of breast cancer.
Okay.
Ductal carcinoma in situ, standing in place, is what in situ means. So you have this circular tube intact with cells that have been transformed into cancer because the DNA is altered. But they can't get outside the duct wall, so they can never access lymphatics or bloodstream and spread. Okay. So it is very easily treated and cured by cutting it out. However, data will show about a 40% recurrence in the surrounding breast tissue unless you radiate after cutting it out. Now, this can get much more precise about you and your DCIS and the genomics of your DCIS, the actual like fingerprint of your personal cancer. We run it through diagnostic testing, and instead of being broad-based numbers of 40% recurrence without radiation, 4% recurrence if you do radiate, we actually have your DNA numbers. And it could be even higher than that, like a 65% chance if you don't radiate. But a lot of the time, it's exactly like this. 7% chance of recurrence if you radiate, 7% chance if you don't. Boom. We just eliminated even the stress and thought about needing radiation for you because it's not going to be helpful.
Gotcha.
So that is how, perfect example of overtreatment. We overtreat again, when I say things like there's always individualization in conversations, but if you just standard of care for your average
blanket
woman,
average,
yes, DCIS is treated with lumpectomy followed by radiation versus mastectomy. And not every DCIS needed that, so it's overtreatment. And when we think about overdiagnosis, that's because, listen to this, DCIS can regress and disappear. So you went and found it when it was on its way to going, gone. But now we found it. So now we're going to treat it. There was a brilliant study, because it was a cadaver study looking at 854 women who had died without a living diagnosis of breast cancer. So we have double that, 1,700 breasts that they looked at. This is going to blow your mind. In women who were 40 to 50 years old, guess how many of the breasts had DCIS?
30%.
That's such a great guess. 39.
Oh, I'm good.
You are really good.
But that's still higher than what I would think. That's so high.
Then look at the 50 to 70-year-olds. Guess how many of them had DCIS?
Oh my gosh. I'm going to mess up my record here. I'm going to say 40% on this one.
10.
10?
75% of DCIS magically regresses. When? Oh, when we cross over the threshold of menopause, it seems like.
So do we even need to be treating it?
Now, thankfully, we have genomics. So we can get in, when I get a core biopsy back of DCIS, before we even decide on the definitive next steps, I do this genomic analysis
to make that decision,
to help us understand like how mad is this DCIS? Because we have in other literature, we're going to land more safely to say 1/3 of all DCIS progresses. It eventually grows and grows, breaks through that duct wall that I was saying was the thing containing it from getting into blood vessels or lymphatics. It breaks it. It becomes invasion. Now we're into stages 1, 2, 3, 4.
Got it.
Okay. 30%, a third will break the duct wall and invade. 2/3 either stays put or disappears.
And those are usually the 0s or the 1s, but the 2s and 3s are invasive. Correct. So 1 is invasive also. It just hasn't gone to any lymph nodes yet, thankfully.
Gotcha. So the stage 0 DCIS, 1/3 will eventually break the wall and become invasion. 2/3 of all we diagnose around 60,000 women with DCIS year after year after year. This year, 20,000. Thank goodness we figured it out, because it was going to invade and that would be a bigger threat. The other 40,000, lumpectomies, radiation, mastectomies, anti-estrogen pills, putting them into premature menopause and misery for nothing. For nothing.
My stomach.
So yes, to your initial question, we overdiagnose and we overtreat. And it is causing a world of psychosocial, emotional, physical hurt and harm.
So if you're a woman diagnosed with stage 0 DCIS, which I have to go back and check. I think my mom actually was diagnosed with that. But who do they turn to get the right counsel on this? I know they come to my practice. I know a lot of them are overtreated, exactly what you mentioned there. Who do you go to? I mean, are you seeing everyone? You're going to see everyone.
I can see all of you.
Women around the world, come see Dr. Funk. I mean, how do you find someone who's thinking this way?
I find it difficult to find like-minded colleagues, but not impossible. So women, if you're in this situation, while I can't see everyone and I would love to, and I don't work on charities either, so I get that it's not always affordable, but I am accessible via Zoom. Like, I am happy to review cases and provide advice.
Well, there's also your energy, right? Speaking of stress, like there's only so much energy. So
so women, keep calling. Try to find a community online and figure out who that person's doctor was. Hopefully they're, in your zip code radius. Keep asking if you have an integrative medicine doctor. Hopefully that doctor has a community and a referral base for you. Just keep searching, because it can't be that far away between where you are and where that person is.
And I think it keeps coming back to this issue around women's health in general. Like, get 2, 3, 4 opinions if you need to. Like, really do the work. Don't make that first stop and be like, okay, this is what I'm doing. I think it really needs, you have to be your own advocate still and really kind of dig in overall. Now, you brought something up. We talked about the younger women, what they can and cannot do. We even talked about teenagers, who I'm sure are going to roll their eyes as they listen to this. But, let's talk about the women that are truly getting impacted more consistently with this. And this is women 40 and above, 50 and above. And you mentioned hormone replacement therapy, which is all the rage right now, right? We went from no hormones with the Women's Health Initiative to now everyone's on a patch and a pill, and that's the gold standard. What's happening when it comes to breast cancer with all of this conversation?
Okay. here's the soundbite that you need to know, and then we can dive into some facts and details.
Okay.
Here's the soundbite. Menopause hormone therapy can and does cause and promote breast cancer. However, it almost uniformly does so few and far between. The rates are not that high. And when a cancer is diagnosed, it is almost uniformly a less aggressive, more curable subtype, so much so that the data shows women diagnosed with breast cancer while on MHT have about a 50% drop in mortality.
Interesting.
Relative to the same woman who's diagnosed with a similar cancer not on MHT. In other words, to put that into just easier numbers for people, because percentages can torture you.
Right.
A 1 in 10 chance of dying with your breast cancer diagnosis becomes a 1 in 20 chance if you were on MHT. That is a 50% drop in mortality.
Why? What's what's happening there?
So one of the drivers for 80% of all breast cancers is estrogen. There are receptors on the outside and inside of cells. And when estrogen hits that receptor, it sends a signal to the cancer to multiply and divide. But estrogen-driven cancers are inherently less aggressive than estrogen-negative ones. So much so that, again, with rare exception, an estrogen-negative cancer, so there's no receptor for estrogen, is treated with chemo. Your ticket out of chemo card requires estrogen receptors.
Interesting.
There's no estrogen-negative cancer that's not going to have a chemotherapy discussion. Now, when it's a 1 millimeter thing, if the patient is 80, I mean, again, I always feel like I have to give qualifiers because someone's going to come out with the one story. But I'm talking very big.
Generally,
big numbers of general, this is how it goes down. So it generally is that estrogen-negative cancers are our most aggressive, least curable subtypes of cancer. It doesn't mean they're incurable, but we throw a lot at them, including chemotherapy and immunotherapy. And with estrogen positive, it's less aggressive. So here's the reality that I have studied, and I know the science supports this. Again, the numbers are few, and we can talk exactly what they are. But estrogen, like it or not, is mutagenic and carcinogenic.
All estrogen. Premarin versus our estrogen versus bioidentical estrogen versus estriol. All estrogen?
All of them, not phytoestrogen. Plant-based estrogen. What you're getting from soy, your isoflavones like genistein and daidzein, the lignans you're getting in flax, etc. All of those estrogens. Now, some are worse than others in the formulation. Like we know that medroxyprogesterone acetate, which is the progesterone used in the WHI. But mutagenic and carcinogenic, these are fancy words. Mutagens alter the DNA, the base pair. It's altered, and now the cell is like permanently deranged as cancer. Carcinogenic changes the cell cycle and the way it's moving through its one cell becoming two, and it's potentially like reverse. You can deal with it, but mutagenic is like, you ruined that one.
Right.
So estrogen has the capacity, it's both these things. And this has been shown in science. So, but how does that translate into numbers in people? So let's use the WHI, even though it's a terrible study, right? So the data still is the data for the terrible reality of who they, right? So we had 0 participants under the age of 50, 10% were 50 to 50 years old, 67% were over the age of 60.
Right.
Okay. 35% were obese. It's insane.
We didn't pay attention to that. That's a huge
in a time
number.
In the 1990s when 12% of Americans were obese, they managed to triple the number and put those into the study. Yeah.
Wow. Okay.
So 70% were overweight or obese, just like we are now in America. But back then you had to work at that.
Right.
35% were actively being treated for hypertension. Like 14% had already had an osteoporotic fracture. This is an
These are sicker women. Yeah.
These are sicker women, and the whole thing was that the enrollment was geared toward trying to see if MHT caused accelerated heart attacks, right? And so they didn't have all day, like meaning an entire lifetime to wait. They wanted to see people on the verge of a heart attack, and let's put half of you on hormones and half of you not, right? So this is the perfect population. So the only thing that as it relates to breast cancer that the WHI tells me is what is the risk of giving an overweight, 50% were smokers.
Come on, guys.
Current or former smokers.
Oh, man.
So what is the risk of getting breast cancer if you put a 60-something overweight hypertensive smoker on hormones that her body has not seen in a decade?
Right. Yeah.
And even then, here's the answer. 1 out of every 1,250. What? 1,250 women on hormones, 1 will get a cancer.
That's
she
enough.
would not. Now, prior to the WHI earthquake, which hit the world in July 2002, there was a collaborative analysis in 1997 of all the major studies. 90% of every study ever done looking at hormones and breast cancer was put into this collaborative working group's analysis. So they looked at 51 studies on the subject. And what they found is that for every 1,000 women not on hormones, you have 45 cancers. So that's our baseline risk, 45 out of 1,000. If you're on hormone replacement for 5 years, you're going to add 2 more cancers. So 47 out of 1,000, right? If you're on hormones for 10 years, it's 6 more cancers.
So that's where the 10-year mark came
15 years, 12 more cancers. Okay, so let's stop there. 15 years of hormone replacement, 12 more cancers is a 1.2% increase. So
it's not
that high.
That
And then when you do get a cancer,
it's better.
It's kind of wimpy at killing you.
So for all the women in perimenopause and menopause that are going on hormones, what would be your cautionary advice, or what would you like them to do when you're looking at this from a breast cancer standpoint?
Excellent. So from a breast cancer standpoint, I always look at women's risk for the things that are likely to kill them, which ironically is not breast cancer. It's going to be their heart disease, their stroke, their Alzheimer's. Probably cancer comes before, our major killer is heart disease. Number 2 is cancer.
Right.
And our number 1 breast, breast is the most common cancer. Lung still kills us more often. But the point is, what is your baseline risk? How much of that risk can we and are you willing to manipulate through diet and lifestyle choices to offset then this teeny tiny risk that we might be adding for hormones? Because I'm thinking benefit of hormone replacement outweighs risk for the vast majority. And I'm not just then talking about the things that she dies from, right? So yes, we know MHT, when started particularly within 6 years, but up to 10 years within the change, starting it is protective against heart disease, provided you don't have any underlying heart disease to begin with. And it's obviously very protective against osteoporosis and, more importantly, the impending osteoporotic fracture. A New England Journal of Medicine article just last year showed that 1 in 3 women over the age of 65 who will get an osteoporotic fracture and die from it in the next 12 months. So this is a serious threat to life and just morbidity, right? The hip fracture is no walk in the park, even if you don't die from it.
Right.
It can create a lot of disability, and there goes your favorite pickleball sport, right? Okay, so we look at that. So I want to protect your heart. I want to protect your bones. I want to protect you from colon cancer. We know that's so well.
And your brain, right? Like the brain.
Okay, so the brain stuff is so all over the place. So all over the place with the literature. And I'm really looking at the Lisa Mosconi.
I know. I had that word in my head.
Yeah. But, I think if I understand even her data correctly, we're looking at windows of opportunity to start MHT. And we're still not sure what it means, because while we know starting at 6 years after menopause has completed, since the change happened, is detrimental in terms of dementia. There's the protective window of that first 6 years, but then there's new data that looked at starting it at age 50, and it still had about a 20% increase in dementia. So clearly, I think we just need the aha reality that we had with heart disease. We had the same data with heart disease. Sometimes it increased it, sometimes it decreased it. Oh, I'm pulling my hair out. I'm so confused. Well, confusion has lifted. We now understand. If you have estrogen replacement, so helpful. So stupid. Estrogen's not that smart. Right. So if you already have arterial plaque, it's like, oh, we're building plaque. Let me help you. Yeah. Estrogen piles on more, so it makes heart attack rates go up. Right. But if your arteries are already clear, then estrogen's like, I got you, girl. Yep. Give me a broom. I'm going to sweep these arteries clean, right? So we have to look for the aha moment when it comes to dementia. And we'll get there. We're not there yet. So I'm a little cautionary for those who have a strong family history of dementia and Alzheimer's. And, it does have to do with the ApoE gene and that's a very infrequent thing anyway. Like, where is it? What is it? There's something in addition to the hormone that either you lack it and it's going to be protective against dementia, or you have it and the hormones are going to contribute to dementia.
I wonder, and I don't have research articles to quote, but now I'm going to start looking at this in practice. I wonder if it all goes back to those two words, if it all goes back to oxidative stress and inflammation. If those are already pre-existing within you, and then we layer on hormones on top of that, do we add fuel to fire, right? Versus if we did it the other way around, where we manage the oxidative stress and the inflammation and then add in hormones. Right. So that would be super interesting to look at.
I can't wait till we figure it out. We're on the cusp because there's a groundswell of interest and demand. So we will figure it out, we being the collective.
The collective, it takes all of us.
But I want to finish one other thought, which is my first line of thinking on the MHT was the stuff inside of you that you're largely unaware of, right? You may have had a DEXA, so you know your bone density, but I'm talking heart health, brain health, bone health, muscle strength. All of it, right. Okay, these are the big things that I'm most worried about. Whereas you're most worried about probably hot flashing your way to a divorce, right? Like you are feeling insane,
blowing everything up.
Yep, you've got the whole, menopause middle happening.
Yep, all of it.
All the things we know about hot flashes, night sweats, vaginal dryness, mood swings, itchy skin, thinning hair, insomnia, plus the weird things that are being brought to light by so many great pioneers now pushing, this menopause reality to the fore of our minds. So, oh my gosh, the adult acne, the heart palpitations, the frozen shoulder.
It's not normal.
Right? It's all hormonal. And menopause fixes all of it. Right. So hopefully your risk of breast cancer is not so high that I can't readily just espouse the idea and be like, yeah, I'm cheerleading you on. Go for it. Go get dosed with your OB-GYN and let's get you happy again. There are, unfortunately, women who this is just too risky, either factually in my calculation or emotionally for them. And others who don't see it as risk. They see it as embracing a phase of life that their body is naturally moving into, and they want to gently support themselves through this time. But prescriptions aren't their thing. Right. Does that mean misery is their thing? No. So I have so many ideas through traditional Chinese medicine,
love it.
Through alternative, there's so many homeopathic things that actually work. Yeah. So Phil, that's when you do symptom whack-a-mole, but not with prescriptions, with things that are gentle on the body and actually work. So for addressing hot flashes, here's my list of weapons, natural weapons for your hot flash. We're talking about a dry vagina. That first list probably is not going to work on the vagina. So here's the second list, right? So sleep. I've got a great supplement and strategy for sleep hygiene and other things for sleep. But not all things work in all people. We all know this. So we still have to keep reanalyzing and re-strategizing until a woman feels completely supported and healthy and happy.
I mean, I think overall this has been a hopeful conversation, because even when we're talking about women in menopause, when we're talking about younger women, when we're talking about an increased cancer incidence, there's a lot that we can do. And it sounds like women can have their hormones. They just need to be healthy, and really watching these markers of what gets us into trouble, not just with breast cancer, but with so many different conditions that are out there today. What's the future? And you don't have to, you don't have to go too deep, but I'm just curious, what is the future of breast cancer care and treatment? What are you seeing on the horizon? What gets you excited about this field?
immunomodulation, I think, is on the horizon and here. So immunotherapy,
Right.
which was usually just for end stage 4 and really subtype triple negative cancers, has now been moved all the way up into the first line of defense for early stage cancer. That's exciting because it works. It's pretty miraculous. I have these triple negative cancers that will do chemotherapy with immunotherapy prior to surgery. And between 70 to 90% of those cancers are gone.
Wow.
By the time we get to surgery.
With good long-term survival? Are we seeing good data around that?
We are.
Okay.
So it directly correlates. The more toward what's called a PCR, path complete response. So when I do operate, let's say we do a lumpectomy where the clip is where the cancer used to be, and all we have is a clip and a bunch of tumor bed, we call it. You can see the cancer used to be there, but there's no viable cells. If you get the coveted PCR, you have the most excellent prognosis, and it kind of goes from there. The more cells that remain, the higher the risk of the recurrence. That's one thing in cancer care that's really just exploded in the last 5 years, and we're not done yet. So immunotherapy and immunomodulation would be drugs that stoke your own immune system to wake up and annihilate a tumor. The other interesting thing is circulating tumor DNA, being able to do a blood test to see one of two things. Either you already had a cancer, breast cancer, or any solid tumor. We're able to make a blood test unique to you because it's out of your tumor's DNA mutations.
Fascinating.
We make this test and then draw your blood and run it through the test.
Okay.
If you are cured, you can't have those tumor mutations. Those should be in a bucket in a lab somewhere, right? No longer in you. So this is how I monitor all of my cancer patients, with a very uniquely designed tumor test. And believe it or not, Medicare has approved this test.
Oh, wow. Okay.
For stage 2 and above. And usually when Medicare approves something, all the other
Everyone
insurances
else
follow through.
Yep.
And currently the company I'm using, which is the one approved by Medicare, does not charge people when their insurance denies this. So this isn't like a futuristic $10,000 a pop study I'm talking about. This is accessible by any woman here in America with cancer and any solid tumor. So men with prostate, any cancer, they do this.
What's
testing.
the name of it if someone wants to ask their doctor to do it?
Test is called Signatera.
Signatera.
Like signature,
Okay.
but Signatera.
Okay.
And so we run the blood through, and as long as it's 0 and there's none of those mutations seen, it could be that there's a cancer lurking, but it's so low in quantity, it doesn't reach the threshold of detection for the test. Hence, it's not a one and done. I keep testing them every 3 months we kind of make it up and go as the patient wants, but for sure 3 years. But finally, this idea of never being able to tell someone that you're cured goes away. There'll
be a cure.
Well, we can tell them they are cured because their blood is 0.
Wow.
Not one time, but we'll figure it out. Like, it's still in evolution. The company's been around for a decade, but it's we need a little more data. And then we're going to be able to have the track record to be like, aha, your subtype, if you're zeros for, say, 24 months, we know the chances of it coming back are like 1 in 1,000, and you're fine.
This has been such a great conversation. I've been more excited about breast cancer than ever before. This has been such a hopeful, upbeat, positive, great things happening type conversation. And the science is coming along, understanding where your spirit and your lifestyle and all those other things fit into it, equally important. So I really want to thank you for spending time helping us all understand this. It's so important. It's been so enlightening. Talk to us, or let us know what you're up to. What are you up to next? Just you. We were talking about the fact that you have triplets, you run a practice, you're an avid exerciser. What's next for you? You've had a lot of roles over the last few years or so as a physician, as a leading physician. So talk to us a little bit about where your energy is going and what's next for you.
A lot of energy is going into my Cancer Kicking Summit. So this is really fun. The Cancer Kicking Summit is a 3-day affair. Okay. And the ones you can just, in the interest of being evergreen, pinklotus.com/summit. Tell you where I'm going. But upcoming in May 2025, I have one in Palm Springs, California, and one in Hot Springs, Arkansas.
Oh, wow.
Yeah.
Okay. Gotcha.
And this is just a really beautiful, transformative 3-day weekend where I bring hundreds of women together to really understand this actionable power, right? And this idea that you can transform your life. You have agency over your health destiny, but let's be practical about it. Like, what am I actually talking about? Like, it's great to get the real top of the mountain experience where you're so jazzed, and then you get home and
real life hits.
Back to the grind. The traffic is still there. The fridge is full of carcinogenic food that I told you to get rid of. How do we do this? So it really, I use science. So the kind of twist on my summit, different than other kind of things that you would go to, is that I'm basing everything in research and teaching you the research in a fun way so that you can digest it and be incentivized and not feel like you're buying into some sort of like just idea, but it's actually been tested and shown that this matters for you. So in other words, I don't just talk about what to eat and what not to eat. We dive deeper into exercise, into love and relationships and stress management and forgiveness. We dive into learning the pathways of the brain and thinking and how much thought influences everything. All of it, right? And meditation is a whole entire focus that we have. There's so much power in meditation. So there's a lot that we talk about, and then we have breakout sessions where you can pick what you want to go a little deeper. I have a 2-hour menopause hormone therapy breakout. And then there's activities and camaraderie. It's definitely not a cancer summit. It's cancer kicking, whether you have it, had it, or never want it. So it's really for everyone. It's great. The Palm Springs one happens to be purposefully over Mother's Day weekend because I think it's a great mom-daughter event.
I love it. Well, thank you so much. Last question before I let you go. What makes you whole? We talk about becoming whole, being on healing journeys. We know it's both science and spirit. We know it's numbers and your emotions. What makes you whole?
What makes me whole is remembering that I only have 3 passions in life. And nurturing each one of them every single day in some capacity keeps me whole. And those 3 passions are a strong foundational belief in God and nurturing that spiritual relationship, loving my family, and killing cancer.
Love it. Love it. This has been amazing. Thank you so much for joining us. I appreciate it.